pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Not aware of any special presentations or proclamations this evening. I think we're ready for oral communications. Have we had any requests for oral communications?
Yes, we have one speaker, Rachel Graves. Just put a sucky in my mouth, sorry. Bad timing. I'm sure you'll hear from the sheriff deputies today, some updates on crime in town, but I don't know if you guys look at calls for service. It's very disturbing. In the last couple of weeks, there's been over 10 indecent exposures in town. When we asked Captain Lawrence, he said they're all different people. It's not like we have one person doing this, and only one arrest out of those 10. So our city's like experiencing this indecent exposure all over, but I don't know if there's anything we can do about this. It's just something probably doesn't make people feel very safe or healthy in town. Also, over the weekend, we had 2 rapes. And I'm sure you know I'm pretty passionate about the increase in drunk driving going on. And I just wish I heard advocation. I wish I heard advocates on this panel for those kind of things that are real problems that we're experiencing here and are, actually affecting our lives daily. I spoke at council meeting in opposition of the work plan that also I don't believe was seconded before being voted in. However, I've already talked to them about that. I don't believe that Marlon seconded the motion for the work plan last time. And so I really urge you all to read Robert's rules. I urge you all to look at California Code, I think it's 54952, which governs meetings and special committees, standing committees, ad hoc committees, as well as the Brown Act, which exempts ad hoc committees for the very reason that they are very specific in nature, made to be ad hoc actually means as needed, and are meant to be in short time frames, temporary. They exempt those because the public is very aware of the very specific task you are to do at those meetings. And so we don't need to be present, or we don't feel like we need to be present because we know exactly what you're doing. But when you make ad hoc committees and you describe them many, many times as broad, overarching, as having lots of different goals, and you say things like, we can decide on what we want to do once we start meeting, those do not qualify as ad hoc committees. I don't care what Tarquin Preziosi says, who was asleep half of the meeting, but every other attorney here, my husband's a federal attorney, knows what an ad hoc meeting is, what an ad hoc committee is, and what is a standing committee. The things you have designated in your work plan are absolutely standing committee meetings. None of us know, including the council, what actions, what tasks you are going to be working on. They're very generic. You guys don't even know exactly what you're going to be working on. That is unfair to the public. We like trust and transparency, and we are not feeling it. I don't like it, and I think you guys should do better. Thank you.
That concludes speakers.
Are there any noted changes to the agenda?
There are no changes to the agenda.
So I'd like to move to the approval of the minutes.
I'd like to make a motion to approve last meeting's minutes.
I second that.
Move to vote.
Okay.
Let the record show that motion passes with Andrade and Vice Chair Dominguez absent.
Thank you. That brings us to Section 8, the public safety reports. First on the agenda is the update on the Fitch assessments reports from our Fire Chief, Joshua Gordon.
Good afternoon, Commissioners. Thank you for having us again. So the request was to kind of go over the Liebenhain evacuation analysis and the recommendations that it had, as well as the standards of cover recommendations. So what we do is we use this spreadsheet, actually this Excel spreadsheet that Lois Young created for us when she was in fire with us. So it's going to be a little bit dry and boring. The recommendations are obviously numbered and in an Excel spreadsheet. So bear with me. So what we'll do is go through each one of them. First one was continue to support the Firewise community concept. And in Liebenhain, we are working in collaboration with the Liebenhain Fire Safe Council. They have completed their community wildland protection plan, which is something that they have to do as the council, the safety council, and as well as working towards the Firewise community designation. So we are collaborating with them. This is all in support with the fire department. They have to move forward and do this work on their own, but we do support them and help get them over the hump when we need to. Adopt, enhance, and targeted vegetation management ordinances. We utilize the California State Vegetation Government Code, the management code, for that, and the city adopts that standard. So we already have that. We have not enhanced it any. We're just using the state's code. Enhance the defensible space inspection program. We use AB 38 right now, Assembly Bill 38, which for any home that's for sale, we have to do a defensible space inspection. And then we also utilize fire prevention services who follow up on complaints and any noticing. So the 30, 60, 90-day notices. And if needed, we use them for abatement. Number 4 was ensure Encinitas planning standards are aligned with the Firewise community concept. Our fire prevention, as they do permits and plan reviews, they already have the Firewise community concept as part of their working conditions, so they already apply it. Number 5, require new developments to design a wildfire mitigation plan and funding source to support ongoing fuels management. Our fire prevention requires wildland or wildfire mitigation plan for development, but we don't have any requirement or ordinance right now that says that development has to provide funding for any ongoing fuel management. Number 6, when fire weather or emerging incidents increase the probability of wildfire threat to Liebenhain, consider the following pre-incident protective actions. So 1 was advise owners to relocate large animals to pre-identified areas of refuge. And 2, suspend infrastructure projects that may impede traffic flow. So we'll kind of talk about the large animal evacuation a little bit later also, because there's another recommendation in there. But we have met with community once, basically said they need to identify temporary refuge areas for their large animals. But since then, we have not ourselves as the fire department went out and identified those TRAs, we call them temporary refuge areas. So any infrastructure projects that might be happening, we work with city staff already. So if there's any kind of traffic delays or any kind of work that might spark a fire, we already know about that and work with our city staff to make sure that that stuff's not happening during high wildland weather or events. So we do coordinate with them already. Number 7, ensure schools, care facilities, and at-risk populations are notified of the threat and review emergency plans to prepare for evacuation. So as well as the large animals and the schools, we have, and we'll talk about this also later on, a new platform called Genesis, which is what we used to call Zone Haven. They changed the names, but they are an early identification platform, right? So they'll give us our early evacuation notices, or for large animals, we could have them send out an evacuation warning with large animals being first. So it just depends on what the need is during that time, but we can use those platforms for both schools and the large animal community. Our fire prevention already looks at their FEMA evacuation plans, their emergency plans. If it's a school, if it's a care facility, any at-risk populations, our prevention already looks at those emergency plans. So we already do that. Develop a comprehensive large animal evacuation rescue program. We haven't even started that, to be honest. We don't, at the moment, have the bandwidth to get there. We have had some good conversations with key stakeholders in Liebenhain. And so that is on our priority list. We just haven't got there. Improve secondary egress options to the north and east, including Canyon de Oro Road and the proposed emergency exit at the end of Boomin Road. So Canyon de Oro, a lot of Liebenhain people know this has already been paved. It is a little bit of a hot topic from Rancho Santa Fe coming into Liebenhain during a wildland fire. It also can work in the reverse. If we did have a west to east evacuation that was needed, Liebenhain could go out Canyon de Oro into Elfin Forest and through Rancho Santa Fe Road and for an egress. And then the Boomin Road, there's a development that's supposed to be out there at the end of Boomin that hasn't started yet, and there's some existing evacuation plan edits that need to be done once that happens, but there's no construction at this time. So once that starts, we'll get into creating that evacuation plan. The 10, mark the wildfire evacuation route with fixed and visible signage. That is completed. Restrict traffic calming measures on all roadways used as evacuation routes. That's done. We've obviously there's no traffic calming measures like speed cushions or speed bumps allowed in the very high fire hazard severity zones. We do work with our streets and engineering to make sure that anything that's done out there we deem as still being safe. So we have had some lane line work, which would kind of help reduce traffic, but at the same time, if there's an evacuation that's needed, lines can be driven over. So it doesn't really slow our evacuation routes down. 12, make Rancho Santa Fe Road improvements to reduce overall travel time. That's an ongoing project with vegetation management and just making sure that it's suitable for evacuations. Identify Mira Costa College as potential assembly point and reunification location. That's 13. That's already done. That's in our evacuation plan. 14, adopt a zone phase approach to evacuations. That is complete. If you go on our website under public safety, you can see those zones. And when we go to evacuate the community, we will do it by zones first. So whoever is in the greatest danger, we would start with evacuation warnings and orders and make sure that it's a phased evacuation so that's more organized. Create evacuation zones using the San Diego County map grids. That's already been completed. Utilize a real-time evacuation planning platform, Zone Haven on here. This is our old list, but it is now called Genesis, and that is completed. It actually rolls out May 1st. So if you have not downloaded the Genesis app, download it or come ask us and we can help you download it. It's in addition to SD Emergency or SD Alert, and that's just another alerting platform that we have for evacuations. And the whole county is using it too, so we're all on board. The sheriffs are using it, we're using it. It's a good tool, we're excited to have it. And then develop concise and understandable pre-recorded public messages. We have not done that yet, and hopefully we can get to that one soon. So other suggestions was the evacuation plan should be updated at regular intervals to ensure changes in the community, emerging or mitigated threats, and available resources are reflecting in the document. So this is ongoing. So anytime we have a large event, let's say we do have a wildland fire that comes through Liebenhain, after that event, we will update our evacuation plan based on the weaknesses we found or some needs that we found in the plan during the actual event. Anytime there's a high fire weather event, we take a look at that and make sure that everyone's up to date with it. Every year we look at it, and there's any large developments that go in, we will take it back out and look to make sure that it's still providing the best evacuation routes. This second one under the suggested ones that's lined out here, that was a suggestion to not use some of the evacuation routes that I ended up putting into the evacuation plan, like going west on Encinitas Boulevard or north up to Rancho Santa Fe Road. Some of these edits were based on some traffic patterns and time of days, but really we feel that with using sheriffs or public works or lifeguards or anybody that we can to help facilitate and control traffic, that we're going to use it. So if we need to open up certain evacuation routes, we're going to, right? So that was why we lined that out. And then in the event of a no-notice evacuation or an evacuation initiated during an onshore wind event, as illustrated in the table 2, so if you look at the evacuation plan, horses and other large animals should be sheltered in pre-identified temporary refuge areas. So we did talk about that, right? We have not identified these TRAs yet. It's strongly recommended that large animal owners in the community work collaboratively, to identify TRAs for large animal sheltering. When fire weather increases the potential for a wind-driven fire to threaten Levenheim, large animals should be preemptively moved to locations that will not require immediate TRAs. So in essence, it's the same thing we talked about, have not started TRAs. We do, on the other hand, have the San Diego County Fairgrounds as our evacuation site for large animals. Now, they will not take large animals unless we as a city, with the city manager, declare an emergency. And so once we declare an emergency, they will take everybody. So even in the evacuation plan, we've written in there a 2-hour buffer so that when we do have some kind of east fire moving west, that we are quick and early, and we make sure that we declare an emergency so that we can get the large animals out also, so in a more efficient way. So that is the Levenheim recommendations. The next is the risk assessment and the standard of cover. So we'll go through this one a little quicker. It's a little bit more in progress, and a lot more has been accomplished with this one. So number one, consider adopting a rural level of service matrix for planning areas with less than 1,000 people per square mile, Station 6 service area. This would include a travel time goal of 8 to 10 minutes for a total response time of 11 to 13 minutes. We've already hit that benchmark. We've already, the city council's adopted that response time standard, and we're meeting that right now. And number two, consider upgrading the fire apparatus to an ISO recognized triple combination pumper and upstaff to a minimum of 3 per day for Station 6. Now, this is in progress. This is something that is going to take time. This is a capital improvement project. We need a station, a new apparatus, and then 3 full-time employees. So we've given presentations. The infrastructure task force understands what our needs are when it comes to Station 6. And so now it's just really putting the pieces together, and really it's going to take some time to get something like this done. So, but it is on the priority list, and we are working towards that goal. Number 3, develop a list of outcome measurements as a major measurement of performance versus the traditional use of outputs. So in essence, the recommendations want us to track our percentage of structures lost, as well as if we added a 4th person on a fire engine or a fire truck, what would the outcome be different, right? Would we put out a fire quicker? Would we stop a fire within the room of content or the room of origin and not let it spread to other rooms? So this is what this is asking us to do with the outcomes. We're always looking at these numbers. We use benchmarks when we're on the radio, fire stopped or fire controlled, fire contained, primary search. All these are just benchmarks that we use for time slots so that we can identify how long it took to do things with the personnel that we have. So right now, we're within the standards of the NFPA. Number 4, consider validating its critical task analysis, especially in terms of IRF capabilities. So IRF are just what we talked about, those time stamps, along with our data that we collect and these timestamps that we have through dispatch, we also do performance standard evaluations. So what we would do is we would take a crew of 3. We would say, you need to take a fire hose from this fire engine to the second story to put water on the fire. And we would measure or time how long that takes. And so that would create our average of what our response time standard would be when it comes to that specific task. So it helps us really know how well our people are doing compared to the NFPA standards that are out there. So the other suggestions, EMS systems should be evaluating elderly demographic changes in order to better participate in the rising demand on EMS services. Data must be reviewed annually to ensure timely updates to projections. So I'm going to go to a quick picture here. So this is one of the slides we gave in the infrastructure task force, right? So we do look at our future population growth because that would affect public safety, possibly staffing, where our fire apparatus are, our ambulances are. So when we look at possible developments, we want to make sure that we're also counting, the possible people that are going to fill these homes or these developments. So, we use the county's 2.2 people per residence as the average to help with that number. And then obviously multiply it by the amount of residences we have. We look at the commercial buildings that might be coming in. And like the recommendations talked about with the elderly community, we do look at the skilled nursing facilities that are coming in and how they affect our response plans. So the skilled nursing facilities do have a large number of a lot of our EMS calls. So we would take that in consideration when more are coming in and make sure we look at those numbers, those response plans that we have, and make sure that our response model is doing what it's supposed to do. The critical task analysis, the most efficient and effective utilization of resources is to send the most efficient resources to the level of risk and patient acuity identified. So, Chief Sanchez over here has done a lot of work with the North Zone fire departments, all the North County fire departments, and our dispatch called NorthCom to make sure that we're using what's called determinate dispatching now. So when you used to call 911, you would just get everybody coming. Now our dispatchers are trained to triage the call. They'll know if everybody should go with lights and sirens, or if they should just go code 2, which is still responding, but no lights and sirens. And then what resource do they need? Is a fire engine going to go code 3 and an ambulance just go code 2 so that they can make sure it's not an advanced life support call, or are they going to send both of them code 3? So this is what it's talking about. We already do determinate dispatching and triaging the calls for the right resources. Fitch recommends that an upper unit utilization threshold of approximately 0.30 or 30% would be considered best practice. In other words, units and personnel should not exceed 30% or 7 to 8 hours of their workday responding to calls. We already do this. We track unit hour utilization, and we're well below the 7 to 8 hours a day with calls. The effective response force capabilities, it's recommended that the GIS analysis are given greater emphasis for ERF considerations. Again, that's our response times and all those different task measurements that we have. Since the sample size for quantitative analysis are relatively limited, the GIS analysis will provide a more accurate picture of actual performance. Now, we have tried GIS software and platforms before, and the Wi-Fi is always what the limiting factor is. So we'll have a fire engine connected to the Wi-Fi. They will leave the barn or the garage, and then the Wi-Fi is supposed to pick up saying, okay, now they're responding, they're moving. It never happens. It's either still in the fire station when we're on scene, or it picks it up 20 minutes later, or whatever it is. So it's either doesn't work or it's way too expensive for us to use at the moment. So we're still looking at those options, but while we are looking at that recommendation, it's just not viable right now. The performance objectives, benchmarks, and baselines. So we use response data. I'll show you kind of what we do. Well, I'll get to that in a second. And then we use our performance standards, which we talked about already. So the compliance team. The recommendation is that the fire chief has established a compliance team to continuously monitor elements of the standards of coverage and make recommendations for system adjustments. I'm going to save all the rest of that because basically we do this. We have a leadership workshop that we come together and we I'll kind of give you a quick just outline, is we look through all of our strengths and weaknesses, what's working well, what are our leadership themes, what the future is looking like, any turning points that we need to be paying attention to. Let's see. So I can give you guys this if you want. It's very wordy, but it really points out our strengths and weaknesses, what our workload capacities are, and gives some priorities for the future. So we do that based on what we're seeing out in the field and our responses and how well we're doing our job. So we've done this one. Utilizing an analysis of the sensitivity of unit drawdown on response time capabilities may be helpful. So we do have a Excel spreadsheet that we have all of our open spots, what fire engines and ambulances are out of the county or on calls, and we're always looking at what our drawdown capabilities are. We try to make sure that we are always staffed for our city. So we do that. We also have what's called MUMS, or the Move Up Management System, that dispatch uses. So if we get a structure fire here, 4 of our apparatus are automatically going to be on it, possibly 5. So with that, that's pretty much all of our apparatus in our city, right? So dispatch will move the fire engines and ambulances all around the county to make sure that our response times are being covered while we're fighting a fire. So that is California law. It's automatic aid now, and it works really well. Last, the agency should start tracking more closely the percentage of fire damage to structures within their NFIRS reporting system. We do. We track the percentage already in our system. We also track the amount of structure we saved, as well as if we didn't show up, what we saved also, right? So there's a structure, and then within 10 feet, if there's any other structures, that's also considered a save. So looking back at 2023, we had 7 legitimate structure fires where we saved over $60 million worth of property. So with a budget of approximately $20 million, it was a good return of investment, right? So just good numbers to make sure that we're looking at and make sure we're really providing a good value to our community. The rest of these are from the administrative assessment and what their recommendations are. I'm going to skip these because these are more internal looking than they are external looking to the community. But we can have more conversation in the future if you guys would like. With that, I'm going to switch on over to the health and wellness. Is that the next one, Lois? Sorry. Okay. All right, so our health and wellness program right now.
Chief, maybe if we just keep on agenda item 8A right now, and maybe see if there's any questions that are come regarding the report, if we could.
Yeah, of course. I thought they were married together, so I apologize.
It'd be fine. Be great. Trevon?
Yes, thank you. So I think that the Alevinhead community in general is very happy with the way that the fire department has embraced the fire evacuation issues. I know you're aware of the many meetings that we had at the town hall with your predecessor, and just the tremendous amount of community interest. The section that you'd lined out was one of the most controversial, and you certainly bought a lot of goodwill. I think that your local familiarity with Alevinhead is respected by the community, and we see what you see, which is it doesn't make sense not to drive down Encinitas Boulevard if you're coming that way, and several of those other changes. Recognizing the lifeguards as a trained emergency response resource that would be available in an emergency was very valuable. Opening up or recognizing that the Morning Sun Gate and going through the Village Park, Calle Cervo, would be useful things to have front of mind and make sure that that's into the record as people are preparing when the Santa Anas are coming in and we're all nervous. So thank you for all of that. I think the other thing that the community is nervous about, though, is we adopted the bifurcated standards of coverage, the response time issues. And I think that for the EMS responses, that's not really an issue. I know that the community is very happy with the EMS responses. However, fire response is a little bit of a different issue. The longer response time is also being responded to with the, I guess, substandard engine. And in an area like Olivenhain, we talked about this with the Old Valley Ranch incident at a prior commission meeting, right? So that engine wasn't able to put water on that structure until, additional engines were on site. And as you know, Olivenhain is a fairly low density area. So many houses are several houses away from fire hydrants. And I guess when we see the depth of coverage maps that were in the Fitch report, Olivenhain stands out as not having that second and third and fourth engine on site nearly as fast as the more coastal regions. And I guess the question is, as you've brought the need to the infrastructure task force. The infrastructure task force has prioritized it with everything else. City council seems to have said we don't have the money to pay for it. We need a sales tax. Hopefully we get the sales tax and it gets in the list. And I hear all of that and I get it. But at the same time, all that takes time. And we've adopted the bifurcated response times a year or two ago. We haven't yet upgraded the first responding engine to be able to put water on many of these fires. What can we do to bridge that gap and get water on the fires to all of the houses in Olivenhain in time to save them?
Thanks for the question. I think, obviously, the Olivenhain community is definitely worried about that fire station and the type of apparatuses out there. It's I've gotten plenty of emails and phone calls about it. So I think right now, really with the funding being the big question, right, and the priority is there. It's just we have to find ways to find the money. There's a lot of infrastructure needs in the city, and so I don't want to necessarily say that the fire station is the number one priority. There's flooding, there's street improvement, there's a lot of other things that can also be public safety. So with that said, right now, seeing what the tax measure does, or what the infrastructure task force says, and then moving forward with that is going to be our quickest path forward. We are working as a team on the back end to try to figure out other ways to provide additional resources quicker. When we talked about that determinant dispatching earlier, if there is any kind of smoke check or trash fire or any other fire code, and I say code by what the dispatch is coding is as a type of incident, we're always sending an engine with that type 6 apparatus now. So it's never going to get there by itself and then say, oh no, we can't handle this, and then call more resources. We're sending an extra resource with that each time now. Of course, they're going to arrive on scene first if they're close to a hydrant or can make an initial fire attack with the water they have in their apparatus, they will. Those will be smaller fires, yes, but putting the smaller fires out is what stops the bigger fires from happening, right? So right now, those are the steps we're taking, and then we're working on the back end to make sure that we have a plan going forward for providing a fire station in the future, providing a type 1 fire engine, a real fire engine, not just a type 6, and then 3 personnel. So all those are in the future. We are working with the city to try and get those things to come to fruition, but right now it's just us planning and trying to make it happen. I hope that answers your question.
So is there anything that we can do to help you realize that vision sooner?
As the Public Health and Safety Commission, I'm not sure there's necessarily any recommendations out there that would be different than what we have, right? The city council is well aware of my position on getting a fire station. They're very supportive, but again, there's a lot of needs in our city. So if you come up with a recommendation that might help, right now I could not think of one through the commission. That probably hasn't been vetted out and tested, but we're willing to listen, and if you have anything, we're right here.
So for my fellow commissioners, I guess the thing for a guy from Leeuwenhoek saying fires in Leeuwenhoek is a big risk doesn't carry a lot of weight citywide. And so I guess the question is, recognizing what we're talking about here at this gap, where the engine can't really fight fires in many, many instances back in Leeuwenhoek, would you guys be interested in making a recommendation to City Council as they're doing the capital planning and as they're looking at the infrastructure workforce to make sure that they recognize that being able to put out homes that are on fire is important? Is that something you guys would be interested in?
I know I put in my request to speak. I just don't know if I was waiting for you to call.
We'll start with you. It's not showing up on my screen.
Okay. And Dan, thanks for speaking first. I know that this is the area you are probably most familiar with of all of us up here, and I'm glad to hear that the community is feeling better after that meeting. And I had some of the similar questions, not being very familiar with this. I'm assuming Station 6 is the station that's closest to Leeuwenhoek. Is that correct?
Correct. It's right there off of Rancho Santa Fe Road and Lone Jack.
Okay. And then I saw there's the goal for a minimum of 3 per day. Does that mean currently there's an engineer and a captain that's there and that's
There's a
it?
captain and a firefighter.
Okay.
Yep.
Who's driving the truck?
Well, the firefighter has all our firefighters have Class C driver's license with the firefighter endorsement, so they're allowed to drive that apparatus. 'Cause
Okay.
That fire apparatus is basically a F-350, a big Ford 350 with the pump on the back of it.
Got it. Okay. How many Type 1 engines do we have within the city? I guess my question is, yeah, that would be my first question.
Yeah, so we have 4 that are frontline Type 1 fire engines, Station 1, 2, 3, and 4. And then we have 2, 1 reserve right now, which is for backup. And we have another one is ordered, it's just not all the way outfitted yet, and will be in service within the month. So 2 reserves. So 4 frontline, 2 reserves.
And is there a reason? I'm just wondering what the response time is, or miles between all of the stations or has it been considered having one of those engines moved to Station 6, because that seems to be a higher fire density area, as opposed to keeping it at one of the inland stations that might be closer to one another in proximity?
Yeah, the fire station that houses the apparatus and the crew it only has 2 rooms. The actual garage would not fit a fire engine. So right now it's kind of limited to the personnel and the type of apparatus that's in the.
Okay, so it's not, the goal then is to have a new station built out there plus the apparatus plus adequate staffing?
Correct.
Okay. That makes sense. And I also really appreciate you talking about the tax measure, because I know I've begun to hear things about that within the community and, some naysayers about increasing taxes. And, think it's really important for us to work on education specifically for the Olivenheim community, but also the community at large about how important that is, because just for me understanding where it's like, yeah, maybe we can get a different engine, but there's nowhere to put it there, becomes more and more expensive. We need a place for that. And then I guess it sounds like the EMS response is positive there. I'm just wondering, I guess it doesn't make a difference if you can only have 2 people there to staff higher in fire season, so that there's adequate staffing out there. But if only 2 people can sleep there, then I guess that's not an option either. And we really need to have the station before any of those things could be put into effect. Is that correct?
That's correct, yep.
Okay, thank you. And I will just say that, to your point, Dan, I fully support prioritizing whatever needs to be done to have the funds to make this possible. While I live in the flood zone in Leucadia, I know all too well that the dangers of a fire and what that can happen, and even though it's probably far less common than the flooding we're experiencing, is a lot more catastrophic, not just to property, but to human life as well. So,
Commissioners, if I may remind you that you're just to receive the oral report and have a discussion about it. Regarding recommendations, they will have to be during our action item for during the work plan.
okay, got it. Thanks.
Commissioner Taylor?
Thanks, Chief Gordon, for the very thorough rundown. My questions are centered around community outreach. And the first question is, how often are preparedness reminders sent out to the community? And I ask this because I feel like if people are constantly reminded that, hey, you have to find somewhere for your large animals, hey, maybe you and your family may want to consider, discussing what the evacuation plan for our household is going to be. That would kind of keep it in the front of people's minds. So do you know if anything like that goes out on a regular basis, or what's the periodicity if it does?
Yeah, I believe we don't have anything on a regular basis. We have worked with the Liebenheim Fire Safe Council with some flyers that we've given out, but nothing on a regular basis that we promote or give out.
Okay. And then education on evacuation zones, that's probably in the same vein, because today is my first time hearing about the Genesis app. And I think it seems pretty cool, but I think it would be even better if people in Olivenhain somehow, were reminded, hey, here's this app that you can use to check out your evacuation zones.
Yeah, we plan on doing a media event when
Awesome.
it starts pushing out. The county is actually in charge of doing that. They're providing us the material to give to the council members as well as the community. So that is coming up. All I have for you is that it should be done this week, but you know how the county can be sometimes. So we're just waiting on that presentation.
Oh, that's great to hear. And my other question was answered, so thank you.
Commissioner Sales?
Hi, yeah, thank you for the report. I read through as much as I could of the report with the fire zones and everything. I thought it was very interesting, by the way, and I never knew that, so thank you. My question is about staffing. Do you have sufficient staff? Do you have openings? Does the cost of living impact your staffing in Encinitas?
Our staffing is adequate. We're actually fully staffed at the moment. We do have a couple individuals out on some long-term injuries, but we have not filled those vacancies because they're not vacancies at the moment. But we are fully staffed, and we have been for a few months now, and that's nice because for a couple of years we were really trying to fill a few spots here and there, and a lot of our personnel were getting forced back to work, and the morale was kind of getting low. But now that we're fully staffed, it's really nice for our people.
Can I just ask you also to clarify the Northcom, I think you called it the dispatchers?
Mm-hmm.
Can you explain again, or more clearly for me, So they're doing a different kind of triage now than they used to do?
Yeah, so it's the North Zone dispatch. It's a JPA. All the departments in North San Diego County are part of this Joint Powers Authority. So they used to take a phone call and provide some kind of medical assistance, whether it was CPR, open the airway, or give some, basic life support. Now with the new training that all of our dispatchers go through, they're a little bit more advanced. So they have a series of questions that they have to ask. They're auto-populated based on the chief complaint so that when they ask these questions, the prompts don't let them forget, and then they can accurately assign the correct amount of resources or type of resource to that call. There's still have a abdominal pain and you get there and now it's a full cardiac arrest, right? So there's still a focus on making sure that we're providing the right amount of resources to the call, but with an idea of trying to be as efficient and resourceful as possible at the same time.
So if you got a call, or that North Zone dispatchers got a call for mental health, behavioral health emergency, would they triage to the Access and Crisis Line, 988? I mean, how does that work?
It's hard to say because there's so many different mental health problems. If we're going to go, our sheriffs are going to come, and we're also have the PERT team that would show up. After that, I'm not sure what other calls go out, because we show up, and unfortunately, we end up leaving quicker if we're not transporting. The sheriffs and the PERT team would have to stay longer than we would, so I'm not sure what happens after that.
Would MCRT be part of that?
The what?
Possible MCRT, the Mobile Crisis Response Team?
Yeah, that's one of the resources too, yeah.
All right, thank you.
Thank you, Chief. Thank you very much. Two things. There was a document that you said you might provide to all of us that made us very dizzy as you were going through. The name of that document again was?
Was it on this PowerPoint?
Yeah, on this one.
It's our leadership workshop that we gave. We gave our strengths, our SWOT,
Yeah.
analysis of our department and our future goals and what we're looking at for our department as it comes to the community. So
Yes.
I can provide that for you guys, yeah.
Thank you very much. Thank you very much. And then additionally, it's a bit of may seem ancillary, but it was brought up during our work plan submission to the council that we were calling out Olevenhain, and they asked that we also pay attention to other high-risk areas in Encinitas in full. So while this report was functioned and this work was all functioned around Olevenhain and the specific challenges there, were there perhaps other learnings, ancillary things that we picked up that actually are helping the community as a whole that you could speak about?
Yeah, of course. So we have Saxony Canyon. We have the community that's above with the Wales and Crest area, right, with the very high fire hazard severity zone out there. We're also in charge of Del Mar and Solano Beach and their evacuation plans with Crest Canyon and so on. So the evacuation plan that Fish provided was very detailed, right? And a lot of the information that they gave can be used with those other locations. So working on evacuation plans for those areas as well. We're not completed with them, but we are still providing those kind of resources to those zones, those very high fire hazard severity zones. So we also have some in Leucadia, right off Eolis. So those are very wildland fire hotspots for us, and we're working on providing the same kind of resources to those areas.
Thank you very much.
So I just wanted to respond in part to your question about what kind of information is regularly reported to the community. And so the Fire Safe Council does send out an electronic communication monthly to people who have opted into that. And that's a pretty significant share of the population because, as you can imagine, fire safety is top of mind for a lot of us. There was also the sort of how to survive a catastrophic wildfire event workshop that was just put on within the last month or so back there. So there's a fair amount of work that goes into that public notice I hadn't heard the new name Genesis for the Crest Haven stuff, but the the zone evacuation is pretty well understood back there. The idea that the Del Mar Fairgrounds will be opened 2 hours ahead or, earlier, that actually relieves quite a bit of the resistance that the horse owners and large livestock owners had. Has that been communicated well to the owners of the equestrian community, et cetera? Because this is the first I'd really heard of that.
Yeah, so we've with the Levenheim Fire Safe Council as being part of our mouthpiece for that, as well as some of the horse owners. They've helped spread that news. It has got to everybody, I couldn't tell you. But I did give a presentation to the council that also gave that information too, so.
All right. I think we're ready to move on to 8B. If you would be prepared. Would you like to talk about the mental health?
Let's do it, yep,
Excellent.
okay. All right, so firefighter health and wellness. We're gonna switch gears here, so. So the safety and wellness part of this, obviously safety is a big deal for us. We have policies and procedures, emergency operations plans. We have blue and green sheets where if any accident or injury occurs, we have a big investigation that goes through to make sure that we never do that again, right? We have incident safety officers. We put people through training and they really learn how to make sure that we're being safe. And so safety plays the huge role in what we do, but oftentimes it's harder to identify or really say what wellness is, right? So it's been harder to define. Wellness is all things related to mental and physical fitness of our team members. So physical fitness is a big deal for the firefighters. We have gyms in all of our fire stations, and we provide that adequate workout time for them. The next steps that we're looking at is for the preventative side. So diet, exercise training, ergonomics, so the form, procedures, and core movements on how to lift heavy things like patients or gurneys or other large things we have to move. And then the recovery. So when we have a work comp injury, what does that physical therapy look like? How do we get them back to work as soon as we can? So we're actually working with our risk department right now, who's been very helpful in helping find new resources, and not just one, but multiple resources that we can reach out to. So right now we have annual physicals. We get blood work done, cardiac testing done, hearing, eyesight, all that stuff that you would find in a physical. And we use work partners right now. We also use a company called 1582. Now 1582, the name is based off of the NFPA standard 1582, which is the health and wellness of firefighters. So this company is providing all of our cancer screening, and we're actually looking into going to all of our physicals through them as well. So they do skin checks, they do ultrasounds, they will be doing blood checks, and all of this is overseen by a doctor. And so we're really looking to not to catch cancer, yes, but also catch early identifiers of cancer so that we can help that person quicker and hopefully get them back to work and the right treatment that they need. It's in the fire stations. When it comes to the cancer side, we have what's called decontamination cleaning policies and procedures. We have personal protective equipment, and then clean, mess up, sorry about that. And then clean and storage, cleaning and storage of our PPE and all of our gear. So we also have a cancer decontamination unit, or a CDU, and decontamination wipes. So we have a lot of quick resources, initial resources for us to try to decon ourselves and make sure that we're taking all those carcinogens and all we call it methyl ethyl bad stuff, get that off of us so that we're clean. We do the best we can. Everybody has to go through this after a fire or after any kind of incident that would have some kind of carcinogen involved in it. We also have our new apparatus, which have clean cabs, so no turnouts or our protective gear, our SCBAs, our breathing apparatus, and anything that might have been contaminated is not allowed in the front cab of our fire engines. So all that has to get put in a bag in the back. We have shorts and shoes. We go back to the station, do all of our cancer cleaning, and then get back into our uniforms so we can respond again. And then we also have Plimo vents, which take all of our exhaust off of our fire engines and pushes it out of our fire stations. So that's on the physical side. Our mental well-being, this has been a little bit harder of a push, and it's really now just coming in into the fire service as being important. A lot of type A personalities that don't like to say that they have anything wrong with them, right? They want to just tough through it, and we're changing that paradigm now. And like I said before in a past commission meeting, we're kind of losing this battle, but we are making some ground now. I think we're finally getting some movement, pushing that rock 6 inches forward. Our mental health education and resilience training, we do that every once in a while. We're trying to be more consistent with it. We are looking at a few different companies right now that can provide that training. We have a peer support program in-house. They've all been through training. San Diego City, like I said, they do a great job with this kind of training and providing that training and education to us. So we've gone to their classes, and they've certified a few of our members as true peer counselors. And then the North County Fire Departments all have a zone-wide peer assistance program. So if one of our firefighters does not feel comfortable talking to somebody in the department, they can reach out to another firefighter in another department and be a little bit more private about it. We also have a chaplain program. We have EAP. Obviously, the city has an EAP. We're looking at other EAPs right now that are solely first responder geared. And then we have a critical incident stress debrief and management team. So if there is an incident that meets a threshold or causes some of our firefighters to have a mental health incident, then we can call them. They'll be here within an hour, and they'll meet with our team. And we have used them a few times, and it's been a very good resource for us to use. So in the works, we're trying to look at some organizations also that provide the team building exercises to bring our people closer so that these peer support programs work even better. We're looking at education and resilience training. We're looking at mental wellness clinicians. Right now we have 3 that one is First Alarm Wellness, what we use, but we have 3 others that we're looking into right now and that look very promising for us to be using in addition to just First Alarm. I think the more resources we can give our firefighters to reach out and get mental health, the better. IAFF, the International Association of Firefighters, also has some great resources that we can reach out to. So while the resources are there, it's our job to change the culture and let them reach out and use them and provide them quick access to them, not this long, you have to file this paperwork and get there. And so it's, we need people on the mental health side to be able to just call, and then they come or we go, and that's it. So we also have looking into some substance abuse resources. All these mental health clinicians that we're talking about right now do have those programs, and then, like I said earlier, the additional EAP resources. So we might not have all of these things built in right now, but I can say the collaboration with the risk department right now and our HR has been amazing. We've really pushed the health and wellness initiatives in our fire department further than they have been in a long time, and our firefighters are very grateful for it, and we hope to continue this conversation and keep moving it forward.
Were we going to hear from Captain Lawrence as well?
Yes, they are going to present right now.
Okay. Thank you very much.
Oh, I was just wondering does it make sense to maybe ask questions specific to fire before we move to the sheriff's report on this?
Yeah, we can do that. Keep them back to the microphone if it's specific. And I figured out the speakers. Just make sure you're on 8B when you select you want to speak, and then I'll see you. Because right now I don't see any speakers. Commissioner Taylor.
Thanks again, Chief. My question is with regards to mental health support. You said that there's definitely a bunch of alphas in the room that are pretty reluctant to reaching out for that kind of support. I can understand that. But with that being said, is there any utilization of resources such as retired firefighters that may be able to lend an ear of support? And also, what other things are being done to build that trust? Because I feel like in those instances when people are reluctant to use those resources, there's concern of, you say it's confidential, but is it really confidential? You say that there's no reprisal, but is there really no reprisal? So what kind of things do you all do to kind of, reestablish and, confirm that trust that they should have in the process?
I think the number one thing is for trust is to keep it private, right? And we're taught that from all the peer assistant classes, from the peer counseling clinicians that we use, and it's been that, right? So everyone that has used out and reached it has communicated to the group, the labor group, that yes, it was what they said it was going to be. It is private. They aren't going to go and tell everybody that you reached out for help. So I think really by doing what we say and being the example, right, is going to be a lot more than, hey, we're just telling you that that's what we're going to do.
Right.
So the action is definitely more than the words, right? We do have retired firefighters that are in the peer assistance programs. We don't have any in Encinitas at the moment, but the zone does have them as part of the zone peer assistance program that they have. And I'm not sure, I couldn't tell you if any of our people reached out to retired firefighters, but I know they have been used in the past based on some of the presentations they've given. So.
Awesome. Thank you.
Commissioner Sales?
Do you have mandatory referrals to the EAP, or do you have a staff? You said you had 3 clinicians. Do you have mandatory referrals for people who are clearly struggling or may have alcohol or drug problems that have been noticed? Or
we don't have any policy about mandatory referrals. We do have the peer assistance team will call certain referrals for them to reach out, but we don't have any mandatory referrals.
yeah, I worked in the EAP field for about 10 years, a long time ago, and that was one of the tools that most employers did have, was that referral in case somebody was reluctant, but they clearly may have had PTSD symptoms, and it's obvious to everybody else, but they are not accepting that. So is that something that's been considered, or do you have your ways of working with your employees around that?
With privacy in mind, I can tell you that we have used that method where we've done our referrals, and we've noticed or had other people notice, and they would come to us, and then we would give the referral. We are working on a policy right now that is a threshold policy when we would contact our counseling teams or clinicians to come in and either do an incident debriefing, or we might have them just focus on one person. So right now there's no mandatory referral program, but we do have a policy that's being written as we speak.
Thank you.
I'm not seeing any other speakers, is that correct?
I pressed my button.
Are you under 8B?
Yep. That's what I clicked on. It just showed Robin's name leave, so.
Please speak.
Okay, thank you. I just have a couple questions for the critical incidents response team. Is that something, is it automatically triggered on certain calls that happen, that they will come in no matter what, or is it something that somebody would have to request? You have?
So we are working on that policy right now based on some threshold calls that have happened in the past. We've never had anything like that, and with our push for health and wellness, that is something that we are definitely going to be implementing. So with the policy, we're going to outline certain threshold incidents that would trigger an automatic phone call from a battalion chief or the deputy chief to those clinicians to come now. We have used the incident management teams for debriefing in the past, and like I said, they do a great job.
Okay, yeah, that's helpful. I just think, to your point, that this is a hard nut to crack and move people forward when there's a lot of stigma of asking for somebody to come after a call that might have been triggering for someone, but not everyone else. So that's helpful to know that that policy is in effect. And similarly, I'm wondering, I know that there's mandatory trainings, or almost every day you're working on different trainings, whether it's prescribed burns or those sorts of things. Has it been discussed and considered to similarly require certain kind of mental health trainings that might be like there's someone that's coming in to lead a meditation or breath work or a talk, and it's not something that some people can opt into, but this would be a requirement the same way anyone would go out on a training. I'm just trying to think through of, I'm very familiar with my husband in a fire, that asking for support isn't really something that's cheered on, but if it's something that's required, there might be people realizing, oh, this was actually beneficial. Can we have this come back again, as opposed to putting that one person on the spot to ask for it?
Yeah, I think that's part of the goal with some of these organizations that we're looking at right now, is to bring in that resiliency training is what we're talking about. And we have had a couple sessions over the last 2 years where that stigma was kind of knocked down a little bit, right? We did some coloring, we played with pipe cleaners, we did some breath work, we yelled a lot in this room actually, and guys left feeling like, oh, that was kind of cool, right? So we kind of knocked down that alpha a little bit because of the experience that they had, right? So we are looking into that. It's finding these resiliency training. There's a lot of them out there, but we have to make sure we're picking the ones that really relate to our group the best. The last thing we want to do is bring in some company that hasn't maybe worked with first responders before, and then now we've lost them on that. So we're being pretty picky on who we're bringing, but we are focusing on that resiliency training.
That's great. And the last thing that I would also just ask is if there's, when you find that group, also inquiring about the possibility of bringing families in. I know I've had that opportunity. It's been incredibly helpful. I know for spouses and children to understand what partners might be going through within, and then having that really benefits the whole family. So, but I'm really glad to hear that Encinitas Fire is prioritizing this and know how important it is for those of you that are on the front line. So thank you.
Yeah, so I'd also, anyways, the idea of changing the culture is obviously a very challenging one, as you're aware. And in my experience, the changing of culture is something that often comes from internal leadership, both formal leadership, but much more importantly, informal leadership, the people that people naturally look up to. And when leadership is vulnerable and able to be sort of honest and go first, that can start the ball rolling. And if you've got a critical mass of these informal and formal leaders that are reinforcing and lifting up those pioneering behaviors, that's often a great way to start to change culture, for what it's worth.
Thank you for your talk. I've delved into suicide prevention at the school level and the trainings that are going on. 2 questions. One, do you participate in that as well as far as identifying suicide risk for community members when you engage them? And then secondly, do you have a program as well for helping identify suicide risk inside your staff?
We don't have any training for suicide detection in the fire department. That could be something we look into in the future. For our staff, really it's on the peer assistance, and we are a big family in the fire department, right? We live together, we eat together, we spend 2 weeks at a time together. So, we do look out for each other and watch for our own signs and symptoms, I'll tell you, but there's no formal training that we have for suicide detection.
Okay. I can give you some recommendations. Things that are going on through the CHIP, Community Health Improvement Partners. They have some wonderful programs that they're initiating for the schools. It's a really great program that will help you identify that as well.
Thank you.
Thank you for your patience, Captain. Lawrence?
Absolutely. It's our pleasure. So good evening, commissioners, staff, and citizens that are in attendance. I'd like to introduce Sergeant Kristen Brayman. She is currently over the wellness unit, the sheriff's wellness unit. She was actually instrumental in its creation, its recent creation this past year. And it's twofold in our wellness efforts that we have at the Sheriff's Department. We not only have the wellness unit, but we also have the peer support unit. And we're getting those more and more integrated as we speak. But I don't want to steal any more of her thunder. She has a presentation where she'll go over the wellness unit, the resources that we provide, and then we'll be available for questions at the end.
Thank you.
Well, good afternoon. Thank you for having me. Yes, I'm the sergeant of the wellness unit. This was created in May of 2023. We have had peer support. We've had chaplains. We'll talk about that, but we'll talk about a little bit more what the wellness unit is doing now. We have a focused unit for our employees of the whole Sheriff's Department. So like I said, we'll just talk about the overview of what we do, what services we provide, and also future projects that we're working on. This is our mission statement: support the physical, mental, and emotional health of all our employees is fundamental to creating safer communities and a strong workforce. As a team, we promote personal and professional longevity by developing healthy choices to reduce personal risk factors. And what we like to say is we're here throughout your entire career, from when you sign to retirement time. And notice I didn't say resignment time. We want to have a happy, healthy employees all the way through their retirement time. We do all sign a non-disclosure agreement that's been approved by our legal, all the wellness unit members, as well as peer supporters. We believe this does allow for trust for members to come to us, knowing that we're not going to divulge what they're coming to us for. So some current services that we provide, we are actually teaching at the academy. So cadets are learning about officer wellness in 4 different categories. That's financial wellness. We believe that's important. That causes a lot of stress without some of that training. We have emotional intelligence and substance abuse and mental health are the topics that we teach at the academy. We do have a family wellness day, and what this is after the cadets graduate, they are mandated to actually attend a full day. And what we do is we provide them basically this presentation with all the wellness resources provided to them and their family members. After lunch, their family members do come and attend as well, so they get to learn about what resources are available to them. And we have a new employee orientations. So what that is a new employee is hired, and we have an orientation providing them all the resources to them as well, so they know what we have. Mentoring program, this is just us checking in on new members of the department about a month after their wellness day. We will contact them and see if they have any questions, how's it going, do they need anything. It's just a kind of a question answer type program, so to speak, and just to be there for them. Teachers, this is just an app that allows law enforcement specifically to kind of do the search for them for childcare. It doesn't pay for the childcare, but it does kind of vet the childcare, and it's open 24/7 if that's what they needed, because obviously we're on shift work. So it's an app provided to them. One thing this actually backtrack, since this was created, this PowerPoint actually, we do have a wellness app. It's called Cortico. A lot of law enforcement and first responder agencies are using this. What that is it's an app on your phone. It's confidential. Everyone has the same login, so nobody knows who's logging in. And it provides all information about our peer support program, peer supporters. You can look up and find a peer supporter, the chaplains, the wellness unit, and various other things. You can do a self-test. If you feel maybe you're having drinking issues, you can actually do a self-assessment test, and as soon as you close that app, it goes away for confidentiality. There's no way for anyone to see it. We just went live on this app, so we're super excited. Other agencies around the county are using it as well. Saddles and Service in Cornerstone, this is equine therapy. If you love horses, this is a great decompression time, go with your team or whatnot. We provide that. They're nonprofit organizations that help
deputies or whomever to go and just have a day with the horses and kind of get a better mindset. We do have programs for drug and alcohol addictions. We generally use First Responder Wellness. They're up north, and it is a first responder program for first responders. So they're not in the general public, basically why they need to get through the help that they need. The goal is to get them back on the street, so to speak, and be healthy and come back to the department after. It's a live-in facility as well, and then they have a transition program after that they can go through. And like I said, we have peer support. We have peer support for all different ranks. They're all over the county at different stations and facilities. And they're also professional staff, and there's also sworn that are peer supporters. And our chaplain program, we have one chaplain generally for every facility or station. They're all different denominations, and they do ride-alongs, and they're very active in our department. We do offer couples retreats. This is for the sworn only. This is also offered by a nonprofit, so it helps if any couples are going through any issues, we can offer that as a resource as well. And then we do contract with the Counseling Team International. This is a 24-hour service for anyone to utilize for 10 sessions per issue, is what we like to say. This, again, is confidential. We don't know who goes. We don't track who goes. All we get is a stat that just basically says 2 members of the department use the counseling team. My unit, the wellness unit, we do go on call-outs for critical incidences. These are currently what we go out on. Officer-involved shootings, collisions with sheriff vehicles causing serious injury or death. Hopefully we go on very little of these. Use of force causing death, CPR initiated that results in death, injuries requiring hospitalization, and suicide attempt or suicide or attempted suicide. And what we do is we basically go on scene, we help the deputies or whoever's involved see if they need anything. These will trigger basically very similar to what the FD said as well, that we'll have a debrief that the Counseling Team International runs. The counselor will be there during that debrief and just kind of go over the incident and check in on them basically. And we'll organize that as the wellness unit for that to occur. We do have an embedded actual counselor we just hired in February. She is a former PERT clinician. She's also has her license. She's a licensed marriage therapist, basically, and she's embedded in our unit. She's available to anyone on the department. She is not 24/7 because she is, one of one at this point, but since February, she's already taking clients, and she is confidential. I don't know who she sees. I see her calendar, and it just says client. We do get stats basically saying that she saw 2 employees, and we'll get what they're seen for. So we can kind of monitor if it's stress or if it's mandatory overtime or relationship issues. We can see and gear that information towards a seminar or some kind of training for the future. Like I said, we do have peer support. These are a lot of the things that peer supporters listen to and help out with and get them more resources. They are all over, like I said, the county. They're all over different stations, different ranks. This is just more information about the counseling team. Like I said, they are 24/7, 365, and anyone can call them or we can call them from the wellness unit to get that person the help that they need. Our chaplains also are available 24/7. They do come out on critical incidences, but like I said, they're also on ride-alongs periodically, so they learn and meet all of our members on their department. They attend our meetings. They also can attend debriefs as well. We do have EAP as well, and we typically gear this more towards our non-sworn. They seem to be more along the lines of the non-sworn personnel, but they're available to anybody on the department as well, and they can help with any of these issues listed. Our future projects, Cortigo has actually moved to current. It's actually happening and went live. We are working on a physical fitness type program. Most facilities and stations do have gyms. So we're looking at it, some kind of physical incentive program where maybe they get a day off for passing a physical test. And we're eventually looking at a long-term goal would be actually working out on duty and pretend we're firefighters because they get to work out on duty. But we do have professional support staff development we're working on as well. Stress reduction and resilience training. We're looking into a meal prep program. We know that, at 2 a.m, not a lot of healthy options are open to shift working. So we're looking into how we can do that. We are looking into getting a canine or a wellness dog for the unit and for the department. And then educational seminars, we're already kind of doing this. We have a topic each month that we hone in on. We do send out emails of various topics for training, or maybe if it's a hot topic, we'll send something out as well. And then we have established a hotline, so our hotline for our department is actually 24/7. It will actually ring to one of my deputies who's on call, and they'll respond. And we have an email too, if anyone wants to send us something. We have had that actually work already. People are sending us, hey, did you hear about this incident? Could you check in on this individual or whatnot? And I believe that's all I have, if you have any questions.
Thank you. Commissioner Sales?
Thank you for the presentation. Could you tell us what department or classifications tend to have the most burnout? And do you target those, like, for example, deputies who work in the county jails? I'm thinking, but I'm sure there are other classifications, deputies in the field, et cetera. Do you have any sense of who needs the most help and who requests the most help?
Well, to stay with confidentiality, all of them actually do contact us, whether they're working in the jails or they're working out in patrol. We actually are working with the crime analysis and the crime lab as well, because they see and process a lot of scenes, and they're having contacts through us as well. So it's a tough job, but this is what we're trying to prepare them for and make sure that they know they have resources before it goes too bad.
How do you, another question, how do you prepare, or do you, as your unit, tasked with preparing deputies for the kind of things they might see, the critical incidents that you were talking about?
So actually on our wellness day, we actually bring in either one or two presenters, depending on the time frame. And they're a deputy who's gone through a critical incident, and they kind of a shock and awe a little bit of, this is what you're going to see, and this is how you're going to, these are some resources you can use. And they talk about the resources they use. So they kind of relate to them and say, hey, I needed to talk to a counselor after this because I, had an issue. So we kind of give them a critical incident that's already happened, talk about what they went through, and then also how they can get resources. And on that wellness day as well, we bring in a panel. It typically is people of rank on the department. Some are married to another person on the department. Some are married to a community member, and they're not on the department. And it's kind of answer question session for the family and the deputies to ask anything. It's kind of a free-for-all of what, but we guide the conversation to get them asking questions as well.
Thank you.
I'm not seeing anybody else, is that correct? Commissioner Woods-Drake?
Yeah, I just had one question. I think it's great. Your program looks incredibly robust, and I imagine it's an advantage to be San Diego Sheriff and have all of the resources as opposed to Encinitas Fire is trying to figure out how do they mimic this in such a small department. But this looks really great. I'm wondering, it talks about the Family Wellness Day after orientation, if there's anything that's been implemented. Sounds like this all began in May 2023. There's obviously a number of individuals that were working there prior to that. And so how are you kind of catching people that may have been working there for a long time and bringing their families in again to receive the same sort of resources as new hires might receive at new employee orientation?
So one thing we're looking at is we're calling it a makeup wellness day. And it's going to be a first come, first serve until it caps out at the capacity. And if that seems to be successful, we'll have continued ones. We also are getting the information of where to go out as best we can for them to bring that home to their spouses too. Because we understand, yes, I didn't go through a wellness day when I got hired as well. And then we're sending out, various topics, like I said, to catch people that were not. In addition, we're teaching at the academy and we're doing continued education. We have what's called CPT, and so that's continued education as you go through the department. We are actually involved in those courses as well and teaching officer wellness at those as well.
Commissioner Vaughn?
Yeah, so obviously I'm very supportive of all of this. My only question is there anything we can do to help?
Well, funding is always great, but no, I appreciate it. We're actually on the wellness grant. California has the BSCC wellness grant. So moving forward, we're trying to budget what this is going to look like in the future.
Thank you very much. We don't have any further questions for this agenda item. Thank you. We can go over to number 9, our Public Health and Safety Commission Annual Work Plan. Are there any requests from the public to speak to this right now?
There are no speakers.
Okay, great. Are you all able to see the document? Pull that up? Yeah. In truth, I just figured that out, so it's more of a, hey, look at me, I figured it out kind of thing. I'll call your attention to changes that were made. The work plan was approved. You'll notice that community outreach, missing is the request for a survey. The feedback we receive, surveys are long, arduous, difficult, might be better served at the end of our 2005 rather than 2004. And if we did consider a survey, it's important that they are tactful, right, with specific questions geared towards specific, why we're doing the survey, as opposed to, I think our consensus was kind of like a broad-based, hey, what are you guys thinking? But they found that surveys are most effective when they are pointed specifically. The next key thing that I'll call out was, I even mentioned it under the special projects, so listed number 9. You'll notice that in addition to watching the efforts to safeguard Leeuwenhoek, we also added high-risk fire zones citywide, just trying to be inclusive of everything that was going on in that case. There were a couple of comments that were made from the commissioners. What I'll stand out came from Commissioner Lyons to me. Everybody is very happy with the work that we're doing. She made a comment that our work plan denotes perhaps our own individual specialties, and what she imagines over time what will grow to will be more of a consensus of a commission, right? And that this work plan kind of highlights perhaps each of our own specific backgrounds and our qualifications. And she imagines that work plan next year will look really good, right? And then also just some clarifications were made regarding the ad hoc. When we were forming them, these ad hoc committees, they have a timeline, they have a deadline. This is a work plan for a year. None of us had in mind that this would be sort of de facto standing committees going forward, right? This is a work plan that's for a year, and the commissioners need some clarification about that as well, because just the way it's sort of set up, it doesn't really come across if you're not really paying attention to that. So, any questions about the work plan? Perhaps the city staff might want to give us some direction on, now that we're ad hocs, and making sure that we're towing the line as you'd like to toe the line.
I will say that earlier when Commissioner Vaughn had that recommendation, at that time we couldn't talk about it during the oral report. However, because it's in the work plan, you can talk about that recommendation now if you'd like.
Go ahead.
Yeah, so my request for the rest of the commission was a sense of the commission in terms of interest in providing sort of a unified front that the fire safety at Station 6 is a critical priority.
I see a speaker. Commissioner Taylor.
Yeah, no, I'm on board with it. It's, again, like some of the things that we've talked about, I just feel like if it's already something that's the city's already got their eyeballs on and they have a plan in place to address, I would like to spend our time doing other things, but if the city does not have that, especially that specific language up, then yes, I think it is something that we need to take a hold of. But, I think there's that line of, if they're already doing it, if they already have it for action, yes, I support it, but I don't think we need to do anything additional with it, if any of that made sense.
Chair Morton?
Yes.
So as far as building a new Fire Station 6, so we just had the Infrastructure Task Force complete its mission to look at the backlog in the city of capital improvement projects that are currently slated but do not have funding. Then there was also new capital improvement projects moving forward. That was a very large list. Possibly building, number one, with Fire Station 6, we don't currently have the land to put that on. Secondly, it's about 13 to 20 million. I will tell you, we are getting ready to do our first budget workshop on March 27th. We do not have 13 to 20 million dollars remotely in that vicinity. It did make it on the ITF's list of backlog projects. As Commissioner Woods-Drake had mentioned, there is talk of a sales tax measure that would likely be discussed by council a little bit later this year, and then if approved by council, put on a ballot measure for the residents to vote on. So we appreciate that. It is on their radar, it is on their list. We do not currently have that type of funding in any way, shape, or form in the budget, nor do we have any lending capacity to borrow that.
I'm not seeing any speakers. I have something to say, but if you want to go ahead and talk, go ahead.
Yeah, well, right. So obviously it isn't yet in the pipeline to have the resources to have the fire response in Leeuwenhoek in a timely manner. So to my mind, there is a need to provide sort of that unified voice that this is what we see as a priority, right? We listened to Chief Gordon's presentation. We recognize the gap. We recognize the funding is a challenge, and we're not necessarily able to propose the solution to the funding. But to reinforce the need, I think is something that is entirely consistent with our mandate.
I have one comment to make. Just number 12 in our work plan is to present, to the commission our plan and outcomes and recommendations. So hearing that there is already a concerted effort, there's a lot of attention. I certainly feel that part of our recommendations and outcomes, from my mind, I would be supportive of finding measures that we can. But I see that as going in as part of our year-end report that's going to be due in December and January, unless I hear, something else that we need to do.
Yeah, I mean, from my mind, me and my neighbors' houses are at risk of burning, and waiting until the end of the year to make that point doesn't seem very responsible.
Commissioner Woods-Drake?
I'm wondering, the tax measure or the potential tax measure that was presented at the last city council, or it hasn't been discussed yet?
Commissioner Woods-Drake, it has not been discussed yet. What was presented was the ITF recommendations list of the backlog and new projects. Also, the polling consultant went ahead and did their presentation on the polling that was done in Encinitas. Council further directed to have an outreach specialist to help with outreach that the city can do to let the constituency know of the ballot measure that is could be presented. The ballot measure does have to go to council. It has to be approved by a 4/5 vote in order to put that on the ballot. If it does get a 4/5 vote, it would move to the November 2024 general election.
And there hasn't been anything drafted that would specifically say what that tax measure would go towards, correct?
Commissioner Woods-Drake, the tax ballot measure would be a general tax. So it could be used for a variety of things. One of the things that the polling consultant did poll on was infrastructure in the city. So again, it could be used for various things. It could be used for flooding. It could be used for fire stations. It could be used for paving roads. So if that ballot measure were to go into, if let's say it was approved by council, if it was voted on by the constituency, and then would go into effect, the revenue that the city would probably generate from that sales tax would be about $15 million. So City Council would definitely need to receive that funding in order to be able to allocate that. If the commission so chooses that they do want to recommend funding for Fire Station 6, usually recommendations go to council through a letter, so the commission would need to draft some type of letter. You would need to take that back to a meeting and then send that off to City Council. Lois, when is the next regularly scheduled meeting?
The next regular scheduled meeting is on June 17.
So if you so choose, you could have, whether it's Commissioner Vaughn or Chair Morton draft the letter, but it would need to come back to the full commission in order for you to approve the letter. So June could be the earliest you could get that to City Council.
Are we allowed
sorry,
to?
I wasn't finished. Did you say 15, 1-5, or 50?
1-5.
Okay, thank you. That's helpful to know, too. Okay, thank you. That's helpful.
I just wanted to clarify, the approval process for the letter needs to be in a regularly scheduled meeting. It can't be through an electronic approval or through a special meeting?
It could be through a special meeting. It cannot be done electronically. All meetings have to be fully noticed, and the public has to be able to participate, and it has to be with all of the commissioners present, unless, of course, someone's absent, but it has to be done in a public meeting.
Commissioner Sales?
Well, we have a resource readiness ad hoc committee. It would seem that that committee could draft the letter request. I don't know what other folks think, but
And then bring it to council?
And then bring it to
to the
the-
commission?
yes.
There are, ready to move to a different topic, but it's still related to the work plan. Perhaps each ad hoc could talk about their plans, like in meeting, and then we could round sort of, we're meeting again next in June, right? So what we want to have on that agenda as a result of your ad hoc meetings? If it, would like to talk about that? Dan, you want to talk about the homelessness?
Sure. So Chair Morton and I did have one phone call after the City Council approved the work plan to sort of make sure that we were sort of in alignment. And what we think the appropriate first steps for the ad hoc committee will be to set up a series of stakeholder meetings and really dive into, getting up to speed on the critical issues. And so one of the very first meetings we would imagine would be with Stephen Gonzalez, the city homeless solutions manager, and maybe his direct management team. We would envision trying to set up a meeting with the county outreach specialists, the HOPE team, Deputy Wells and his and any colleagues that he wanted to try to bring on board with that. And then reaching out to sort of a second round, which would be other social service workers in the area. So Community Resource Center, PATH, the St. Andrews, the Philabelli folks that are already working in this space. And then a third area would be sort of adjacent areas that work in this space, like Carlsbad and Vista, to sort of learn best practices. And one that I should have probably put in the first bucket was the Regional Task Force on Homelessness, and they have an outreach specialist or a specialist for the North County region, and so connecting with that individual would also be a sort of first pass issue. And I think that the idea there would be to sort of report back to this group on what we've learned and some recommendations for next steps.
Excellent, thank you. Commissioner Sales?
I'm a little confused. Your ad hoc has not met yet, is that correct?
Chair Morton and I had one phone call after after the city council approved the thing to
Oh,
gather
you-
alignment on what we were wanting to present to this group.
I get it, okay. So we are allowed to have our meetings now with our ad hocs? Okay,
Correct.
got it.
Correct. Along those lines, did Commissioner Woods-Drake or Commissioner Sales, did you have any things? Okay, it's fine. Marlon, you're Commissioner, you're on the hook.
I am a committee of one right now, so with not having any conversations about any of the things on the work plan, we have not met. We have not discussed anything yet. And while I have ideas, seeing that I am one of three voices, I would rather wait to hear the ideas of Commissioners Andrade and Dominguez before I start bloviating up here about what I think we should be doing.
Thank you very much. I think sort of baseline, set expectations, bottom of the barrel, we're going to do lots of things. We definitely have a report that's due out to the council by the end of the year. We have a meeting in June. We have a meeting in September. We have a meeting slated for December, so that's 3 meetings.
So you're saying the June meeting is the first draft, September is...
In loose conversations with the staff, the cadence was probably going to be like a special meeting in November for the draft, right? And then, I mean, that's up for discussion, and then we have that. So I think it's reasonable to expect, we don't need a special agenda item. This is on our work plan. This is what we're talking about. The ad hoc is there. So that's fine, right? Yeah.
So we had a approved request for an update from the Office of Homelessness Solutions Manager. Coming on, just came online this month, and I'll give a little bit of an update at the end on that.
Okay.
But I would propose that we have a special meeting in the May timeframe. I think that what we're seeing is that the presentations take up most of our 2 hours of the regular meetings. And I think that the ad hoc committee would be prepared to do a debrief on our first round of conversations by that May timeframe. And so I would move a special meeting for focus on homelessness for the May timeframe.
I'm not hearing any second.
I see that we have this work plan as an action item, but what's the action? Are we just approving the changes that were made?
Actually, it's more of a notification of, we're not really approving the changes.
Okay.
This is the work plan that the city council approved.
All right.
Tonight is just really for discussion, Commissioners. So as the work plan was approved by City Council, obviously ad hocs could not do any work or anything, so there's really not a lot to report out. So tonight was just discussion items and not really any action.
Oh, okay.
I think that closes the discussion on our work plan. Commissioner, are you on here, Commissioner Taylor, to talk or no?
Oh, I'm good.
Okay.
I did want to just close the loop on the fire risk and Olevenhain conversation. I think Commissioner Salas was suggesting the Committee of One be the ones to draft a letter. Since the Committee of One is the only person that was part of that conversation, would you prefer to draft the letter or have me draft the letter or Chair Morton draft the letter? What are you thinking?
I would love to hear your thoughts on it, so we can collaborate and put it together.
If I could, Lois, when is our next scheduled meeting as a commission? Is it before the June 17th?
You currently do not have any special meetings slated. The next meeting is the regular meeting in June,
Which is what date?
June 17.
We
Yes.
meet the 17th,
Monday, June 17.
and then the letter needs to be available by the 17th as well?
Yes.
Could that actually work? Could we approve it on the 17th and give it to them on the 17th?
Oh, no, you would.
Yeah.
You would have to approve it on the 17th for city council before they go on recess.
Right?
It would be a little tight to make it to their 19th meeting. It would have to be approved by city council in August.
Can I restate my motion?
Feel free.
Hoping for a second for that May special meeting.
Commissioner's correction, the city council will not be approving any recommendation, you're just making it. So once you folks draft the letter in a public meeting, once it is approved by city council, it can be sent to the city council. We did that in the Park and Rec Commission when they recommended open space land. But there's nothing for the city council to approve. You are just recommending prioritizing a fire station in 6, so it's for information and to file.
Thank you. Is there a second?
So June is fine for that date because it was just as long as you folks approve it on that date.
Okay, so
So there's not a need, if we could meet the recommendation timeline if, in our regularly scheduled meeting on the 17th? That's a question.
It will go to city council. By then, the budget will have been approved, and as I had mentioned, we don't have $13 to $20 million for them to allocate. But what the commission is doing is letting the council know that or June.
Then I would second Dan's. I would like to have, can I talk about what I would be in favor of right now in a letter?
No, we don't have that agendized on
Okay.
here. So what you need to do is the folks need to draft a letter. This is item number 9 on your work plan, which is members involved is all. So it doesn't necessarily need to be a specific ad hoc that works on the letter. So if you choose, today you can choose the folks, and it sounds like you've chosen Commissioner Vaughn and Commissioner Taylor to draft the letter, and then it would have to come back to the commission to review the letter and give approval for that to be sent to city council.
Okay, perfect. So in that meeting, if I had modifications to that letter, I would recommend them then.
That's exactly it. You could make modifications at that time, and then again, the whole letter would be approved by the entire commission.
Okay, then I would second Commissioner Vaughn's motion to have a special meeting in May.
All right. We okay to move to vote?
Yes, just to clarify, the motion on the table is Commissioner Vaughn brought forth and Molly Woods Jake seconded to add another meeting in May. Is that correct?
Yes, that's correct.
and we would-
Not a specific date in the motion. That was scheduled around the commission's availability. I think we've done that in the past with special meetings.
We're going to move to vote?
I think you just called the vote. We got a motion. In a second.
Yes, it should pop up on your screen now.
Thank you.
Let the record show that the motion passed unanimously with Commissioner Andrade and Vice Chair Dominguez absent.
And Commissioner Taylor, Commissioner Vaughn, we're going to take a lead on presenting a draft to during that May meeting?
yes.
And I think that as long as it's consistent with the agendized item, if we have any input from commission members on to the direction of that, we'd be welcome to hear those now.
So again, that's not agendized properly on the agenda. So once Commissioner Taylor and Commissioner Vaughn go ahead and draft the letter, which I would take a motion for both of them to do that, and then go ahead and have that approved by the entire commission. You folks can bring back a draft, and that's when it can be discussed. It's not properly agendized on the meeting this evening.
Do I hear a motion?
I'd like to present a motion for Commissioners Taylor and Vaughn to draft the letter to prioritize the new fire station in Olivenhain.
I second.
Let's move to vote.
Let the record show that the letter will be drafted by Commissioner Vaughn and Commissioner Taylor, has passed unanimously with Commissioner Andrade and Vice Chair Dominguez absent.
I think we're ready to move on to informational items. Agenda item 10, in which we have Commissioner Sales.
Okay, so I'm going to talk about two items today. One is SB 43, and one is Care Court. And so I'm going to start with SB 43. So if you could advance the slide, please. Okay, so this was a presentation that was given by Dr. Luke Bergman at the Behavioral Health Advisory Board on March 7th. As you might know, I'm the chair of that board, but I am speaking for myself today, not as chair of the advisory board. This model, you'll see two triangles, one inverted and one in the opposite direction. So it used to be that crisis was on the top, and everything we did in behavioral health services revolved around responding to crises. Over the past few years, things have turned around, and we're looking at the bottom, which is prevention and social determinants of health. And, hopefully through the prevention and also continuous care, crisis has a smaller part, and we're addressing issues before they become larger issues, which crisis services takes a lot of resources and money and personnel. Please advance the slides. Okay, so we're trying to transform the continuum of care, as I just said. So what we're looking at is really how do we serve people who are in crisis, and how do we provide them with services so that they get the service they need in a timely way. Because we know that when services aren't provided in a timely way, everything becomes more of a crisis, becomes more expensive, takes more resources, and and there's a substantial need for residential and long-term care in this county. And that is something, even with a $1 billion budget, the Behavioral Health Service, San Diego County Behavioral Health Services, there's a big shortage of residential and long-term care, especially for folks with Medi-Cal. So what we're trying to do in transforming the continuum of care is trying to get people into care as soon as possible. Next slide, please. So SB 43 is a new bill. It was approved in October. It went to the Board of Supervisors on December 9th to determine whether the implementation would be delayed for 1 or 2 years or implemented immediately. So at that point, the Board of Supervisors voted to delay implementation for 1 year. So beginning on January 1st, 2025, this bill, which basically broadens definition of gravely disabled, expanding involuntary treatment protocols to include severe substance use disorder or co-occurring mental health disorder and a severe substance use disorder, And this is new. So previously, we've had involuntary commitments only for behavioral health, for mental health care. And now it has been expanded. And so the person who would be detained would be somebody who had a severe substance use disorder and has an inability to provide for medical care or personal safety. I will have to say this is very broad, and the county is behavioral health services, and many collaborations have been working on sort of looking at what does this mean and how do we serve the population that is going to be affected. So there's been a number of collaborative multi-sectoral implementation meetings over the last 2 months, starting in January. They returned to the Board of Supervisors on March, well, actually, it'll be going on April 9th. It was supposed to go on March 12th. It's been delayed. But the whole process will be explained at that Board of Supervisors meeting. Next slide. So the collaborative work group included partners from all these different agencies, as you can see. I had the privilege of being involved in these collaborative work groups. And what I could say about it is a lot of great minds at the table trying to look at this as a client-centered approach. So, for example, one of the meetings was the alternatives to the emergency department subgroup, and they started from, okay, what is the client experience from the moment they make contact, presumably with law enforcement, but it could be from referrals from the community, could be from the MCRT, from PERT, from hospitals, and what is the client experience from the beginning? And I thought this was really important. We had a lot of good input. What's come up for me in this whole process is how unprepared the county is, or has been up until now, to be able to implement SB 43. I'm just telling you as a private citizen, not as a chair. But I do believe that with all these people working together, there is a great opportunity to implement this program with fidelity so that the person who is being placed on a 5150 is, first of all, their civil rights are considered, which is really important, that they are getting the best care, that they are getting the least restrictive care that they need. So if somebody has a severe substance use disorder, is homeless, is on the street, can't take care of their basic needs, that when they're brought in, they're directed to the right level of care that they need. So you have these are the 3 work groups. We had the alternatives to the emergency departments. This is really important because right now, emergency departments are handling many of the folks that are brought in on 5150s. They have no place to send them to. There aren't enough services, and I know Captain Lawrence can say this from his point of view, is that the police don't know what to do with folks. They bring them there, they're sitting in hallways, and they're not getting the care they need in a timely manner. We also have the training and education, and we had the San Diego Police Department and the Sheriff's Department and Chula Vista Police Department represented at these meetings. And so a lot of the training and education, and we made lists of who needs to be trained. And the list is very long about who needs to be trained. But law enforcement, the fire departments, the EMS, the hospital employees, MCRT, PERT, everybody needs to be trained on how to implement this bill. And then expanded treatment services and support for those with substance use disorder. So this is where are folks going to go? Who's going to treat them? How is that going to be implemented? Next slide, please. So you can pass through the next 2 slides. There we go. So these are the initial readiness domains that I mentioned. And the last one has to do with updating procedures for the Office of Public Conservator, because it is thought that there are some people who will have to be referred for conservatorship. So there's a lot of work that needs to be done, Next slide, please. So, and some of these are going to be handled immediately. Some have a window of the next 3 months, what's going to happen. Then midterm, which would be from basically July to October. And then long-term is up until the implementation, which is going to happen on January 1st. Next slide, please. That's the end of the slides. Okay.
Yes.
So, so what I wanted to say more about this is that I am pleased that there's been a lot of stakeholder involvement, but the stakeholders have been mostly professionals. We're talking about contractors with behavioral health services, talking about law enforcement, we're talking about the hospital association. So all the stakeholders have a different interest in seeing this implemented in a positive way. What was lacking, and we would love to hear more of, is from people who are actually going to be impacted by this. So folks who are suffering from severe substance abuse disorder. Those are the voices we're not really hearing from. And that there is a concern, and one of the main concerns that was brought up at these meetings is, what happens when somebody is placed on a 5150, say by law enforcement, they're brought to an emergency department, and then they sober up, so it's questionable if they're really going to be able to be held under a 5150 or the extension of that, which is a 5250 for 14 days. So that is a real concern, and I don't think that's really been worked out yet. So there's a lot of work that needs to be done over the next 9 months. This will go to, as I said, to the Board of Supervisors on April 9th. So if anybody's interested, and you can watch it online on YouTube, and you can call in and make comments. And I really encourage folks to really take a deep look at this, because it is being so new in the state. There's a lot of work that needs to be done and a lot of questions. So I can take questions about this if anybody has any initial questions before I move on to Care Court.
I'm not seeing any questions.
Okay. Thank you. I'll move on to Care Court then. Thank you. So both of these presentations are available online on the Behavioral Health Services website in case you want to look. So next slide, please. So Care Court's been in effect since October 1st. San Diego County is one of 7 pilot counties that is sort of testing it out and seeing how it's working. So since there have been actually, so let me explain basically, as you see on the screen, referrals are made by family members, they could be made by law enforcement, they could be made by the person's therapist or counselor or concerned citizen when they see somebody who is clearly suffering from a severe mental illness. They must be diagnosed with schizophrenia or other psychotic disorders. This is really important because there are people being referred to Care Court who don't meet the criteria. And there's a very lengthy petition that needs to be filled out, and you have to have a lot of computer savvy and help filling out that petition. It's many pages long. Someone has to have medical records dating back a long way that is supportive evidence that somebody has this kind of diagnosis. So it's a big deal for somebody to be referred to Care Court. A lot of it is coming from family members, and I think we all know how difficult it would be to have a loved one, an adult son or daughter who struggles with severe mental illness. And most of these mental illnesses come on when somebody is an adult. They don't come on when they're teenagers. Usually the stress of going away to school or moving out of the house precipitate this kind of diagnosis and this kind of breakdown. So can you go on to the next slide, please? So there's a referral, then there is an initial determination based on the petition that lasts 14 days. So a clinician, a team of clinicians from Behavioral Health Services, from their Care Court team, try to make contact with the person. Now, the problem is, and what they're finding so far, and this is the feedback, we had a big meeting on March 4th, and what we found out from the public defender's office, who actually are representing the folks in court, in care court, is that the initial determination is taking way longer than anybody thought, because a lot of times they can't find folks. So I may say I have a loved one and I want to file a petition for them, and they're living on the street and nobody knows where they are. So the process is slow. Once a determination made, there's an investigation by the clinician, and then engagement by, usually Telecare has the contract to provide that engagement. And they're also saying that their engagement is taking quite a long time, much longer than anybody determined. A care plan or a care agreement is made. The difference between a care plan and a care agreement is a care agreement is voluntary. So, for example, if somebody refers their adult son who has a psychotic disorder, and that person is willing to make an agreement to engage in voluntary treatment, then that is an agreement. If a person is not wanting to engage and not wanting to be involved, they are encouraged to have, and then can be mandated to have a care plan by the court. So right now, what we're finding is that it's been taking 60 up to 90 days to engage folks, which is a long time. We're also finding that, there's been 25 CARE Act agreements so far. And San Diego, there's been like 78 petitions, but only 25 agreements, and no care plans yet. So that shows you how difficult this process is. Some of the concerns that if somebody doesn't want treatment is how to engage them. So they're trying to engage folks, for example, somebody's homeless, by offering them shelter, by offering them an apartment or a living situation, by giving them food vouchers, by giving them transportation vouchers. So they're developing trusting relationships with the care managers by doing that. So it's a good strategy, but it's going to take a long time to build trust with folks who've been not trusting the system for a really long time. There's no, and just to remind everybody, there's no forced medication. Nobody can be forced to take any medication that they do not want to. A failed care plan may be utilized as evidence to support higher levels of care. And litigation is still happening because the ACLU and Disability Rights California filed a lawsuit. So this could take a long time to adjudicate, just to let you know. Can you go on to the next page? So I think the rest of it is explanatory. The services can be extended for up to 1 year. Some of the concerns we're hearing from family members is that the process hasn't always worked the way they thought it would, and a lot of these families, they're pretty savvy, and they're involved in NAMI, and they know how to make noise, and they are really advocating for their family members. So there's a lot of issues with care court that are being worked on, and I'm fully confident that it's going to, by the time the pilot ends, we will have a better product and a better situation. Where the Behavioral Health Advisory Board is holding another care court convening in May. So we'll have more updates at that point. But just to let you know who's involved, Legal Aid Society helps families fill out petitions or helps people. They've tried to do outreach in a number of different languages. They have, and to help people who are not computer savvy and can't do it on their own. So that's a really good thing. As I said, the public defenders represent folks in court, so they have make sure that their legal rights are being followed. And who else is involved? That is really important. Anyway, I think that tells you that, and Behavioral Health Services, of course, has clinicians and is overseeing the program. So that's about it. Any questions on any of that I mentioned?
Thank you very much. Dan?
Yeah, just a quick question. Did I hear you correctly say that Telecare is also providing the CARE IHOT team?
They have a special unit that's doing case management specifically for care court.
Separate from the IHOT?
Yes.
More traditional?
Yeah, it's their IHOT team, but they're responsible. Also, CRF, Community Research Foundation, has a contract for voluntary treatment for those.
Okay. And then just an FYI, one of our local residents who qualifies and is a fairly disruptive presence in the city is somebody that has started this process, and with the cooperation of an out-of-county family member. And one of the challenges we're seeing is that when we provide food for the individual, they take that as no longer being gravely disabled because they're getting food. Same thing with car trips and stuff like that. So it's this very counterintuitive issue, which is where if you help somebody, then they no longer qualify.
Yeah. Well, that's what I was saying about SB 43 too. It's the same thing. If somebody becomes sober and they're given food and shelter and clothing, they're not going to be eligible for a 5150 or 5250. So yeah, it is difficult, but that's why I say we should give feedback to the Board of Supervisors on that on April 9th. Well, April 9th is on SB 43, but Behavioral Health Services, you can go on the website and make comments, and if you need any help with that, let me know.
Thank you. I'm not seeing any more questions. That'll move us to Commissioner Member Initiated Agenda Items. I'm not aware of any. Good chance for a time for us to entertain future agenda items. We do have the special meeting to discuss specifically the letter of recommendation.
I'd like to see if we can't get that already approved homelessness report in the same special meeting if we can.
I think that's a standing agenda item, so I don't know if we have to call that out specifically.
No, this was the commission-initiated request for the report from Stephen Gonzalez.
Thank you.
It was
Steve's gonna
seconded
follow up.
and put on, but deferred at his request.
Yeah.
So
Lois?
Commissioner Vaughn, Stephen does have it on his calendar for the June regular meeting. As for the May special meeting, because the May special meeting is not focused on the work plan, it's focused on the letter, we would not be doing the presentation at that time.
Did we set the agenda for the May meeting?
You had mentioned for the special May meeting that you and Commissioner Taylor would bring the letter of support, the draft letter of support.
Yeah, my recollection is that we had two motions. One was for a meeting in May that was seconded and approved unanimously. And the second motion was for the two of us to draft a letter, which was also seconded and universally supported. But I don't think that we've set an agenda for the May meeting that would preclude talking about something else.
So I might be understanding incorrectly. So as of right now, what has been approved by the commission is to have a special May meeting. For that May meeting, it would just be for the draft letter of support approval, review and approval.
Well, but we're also in the part in the meeting where we're adjusting future agenda items, and so is there a reason why we can't have agenda items for the future, for our special meeting?
Okay.
So Commissioners, so generally what a special meeting is, it's specifically focused. For instance, the council meeting this week at 3 o'clock is focused on the Q3 drainage report. So it's one item. When you start having standing items such as different presentations that could occur at a regular meeting, a special meeting is for a specific and special purpose, and that's what the commissions need to stay to. So at your next regularly scheduled meeting, that's when we would have presentations from fire, from the captain. We would have guest speakers. Specifically, a special meeting should be focused on one thing. Your other special meetings were focused on specifically completing the work plan, and we didn't have updates from Chief Gordon or Captain Lawrence. So the special meeting should be specifically focused and then bring back speakers at the June meeting.
Understood?
Yeah, I'm looking at the clock saying 6:15 and wondering what that June dismissal time is going to look like.
Commissioner Taylor?
I think one of the things I'd like to see added in a future agenda item, be it June or afterwards, would be a follow-up on the flooding. You know, what are we doing? What's happening? What's the next steps? And I asked that in June or September timeframe when we're a little bit more removed from the heat of, you know, the flooding now, so we can have a coherent, probably a little bit less emotionally charged conversation about that.
I can second that.
Are you going to talk to this motion, Commissioner Sales, or should we finish the business with that?
My question was about adding, like, to the May meeting, the
Yeah.
report back from the ad hocs?
Okay,
Okay.
we'll get to that.
Okay.
There's motion, it was seconded. Can we move to vote?
Can you repeat the motion, please?
My understanding is you just need a consensus on this
Excellent.
item. It
Thank
does
you.
not need to be a motion to vote.
Thank you. We'll be certain to add it. It'd be fantastic. Your question?
No, just to add for May, are we reporting back on the ad hoc? Not in May?
Just the letter.
Just the letter in May.
That's why we're having, okay.
Yep. Not seeing any more speakers. We can do commission reports roundtable. Dan?
Yeah, I just wanted to let everybody know that the Rancho Buena Vista NAV Center is up and running, and we have, as of last Friday, placed 10 Encinitas unhoused residents into the center, and we have identified several others that are worthy and appropriate when space is available. There's been some ramp-up learnings, as is typical in this sort of a thing, and it's very much a work in progress, but we're helping 10 people.
Excellent. Not seeing anybody else. I think we can move to adjournment. Meeting adjourned.
Specify.